Hello, my name is Shannon Coles. I'm a graduate student at Southwest Baptist University studying nursing administration. Today we are going to talk about health services for special populations. So who is part of the special populations? Racial and ethnic minorities, the uninsured, children, women, those living in rural areas, the homeless, mentally ill, and chronically ill and disabled. What groups are included in racial and ethnic minorities? Black Americans, Hispanic Americans, Asian Americans, American Indian, and Alaska Natives. Black Americans tend to be more economically disadvantaged than whites. They have a shorter life expectancy that is improving, but is still behind their white counterparts. Black males' life expectancy is 71.8 years, compared to 76.5 years for white males. Black females live to be 78 years, compared to 81.3 years for white females. The shorter life expectancy can be attributed to their economic status that affects their access to health care. Higher death rates for a majority of leading causes of death include heart disease, cancer, diabetes, HIV, and homicides. They have a higher mortality rate among 100,000 live births, higher than whites at 23.8 for blacks and 7.7 for whites. They have higher infant, neonatal, and post-neonatal mortality rates as well. Hispanic Americans is a fast-growing population. Between 2000 and 2010, this particular population increased 43%. This population tends to be younger. The median age for Hispanics is 27.4 years compared to 41.2 years for non-Hispanic whites. Of these, 11.3% are below age 5 compared to 5.3% of the non-Hispanic whites. 25.3% of the Hispanic population lives below the federal poverty level compared to 9.8% of non-Hispanic whites. This population tends to drink more alcoholic beverages, but smoke less than other populations. Language can be a huge barrier when it comes to access to health care, especially if you look at where they were born. If they were born outside the U.S., they are less likely to speak English. Due to low level of education, Hispanic Americans have higher unemployment rates than whites. They are likely to be semi-skilled workers in non-professional occupations, and this leads to them being uninsured or underinsured. Hispanic Americans are less likely to seek preventative care, which includes mammograms, and most women do not seek prenatal care until after their first trimester. Asian Americans are another fast-growing population. While there are 32% increase in population between the years 2000 and 2009, there's only approximately 14 million that live in the U.S. Asian Americans tend to obtain higher education more than whites. 52% versus 30% have bachelor's degree levels or higher, which leads to higher income. Their median income is more than $2,000 greater than other populations. This leads to a smaller portion living below poverty level. Cultural practices and attitudes mean they are less likely to get preventative services such as pap smears and breast screenings for women. American Indians and Alaska Natives live in rural and urban areas, with 3/4 of the population not living on reservations or trust lands. Diseases of concern include diabetes, hypertension, infant mortality and morbidity, chemical dependence, HIV, and AIDS. This population tends to have a higher rate of alcoholism, tuberculosis, diabetes, injuries, suicide, and homicide that lead to death. Life expectancy is 4.6 years less than the rest of the U.S. population. Health status is improving despite being poor and unemployed. Contributing to this improvement is the reduction of infant mortality and maternity mortality rates. The Indian Health Service is designed to ensure availability of comprehensive and culturally acceptable health services. This population is outgrowing current services available, including primary and preventative services. The focus of healthcare is education about diabetes, alcoholism, mental health, elder care, HIV and AIDS, injuries, maternal and child health, youth and children, and domestic violence and child abuse. Ethnic minorities, like the ones we just discussed, are more likely to lack health insurance than whites. The lack of higher education contributes to workers not having insurance and access to health care. Depending on where you live, in the South or the West, is also another factor of whether or not you have health insurance. For those who cannot pay for medical services, they tend to not seek help in time or not at all. The uninsured are less likely to seek preventative services and are subsequently in poor health. As of 2011, 38.2% of children were covered by Medicaid and 53.7% were covered by private insurance. More whites than other races receive vaccinations. This can be attributed to poverty status and where they live. Lack of health care leads to reduced ability to learn. If children are sick, they tend to stay home, or they go to school sick, exposing other children depending on their parents' ability to find childcare or take time off work to stay home with the children. There are a large number of parents that do not get paid for taking time off work, even to care for sick children, and therefore send them to school sick. Family and social circumstances cause changes in physical and emotional development. Children are dependent on others to care for them, get them medical care, authorize treatment, and respond to their health needs. The adults include parents, caregivers, school officials, and sometimes neighbors. These relationships change over time and can be very complex. New morbidities increasing among children are drug and alcohol abuse, violence, whether it be within the family or an external environment, learning issues, and emotional disorders. Oral health can be lacking in children as well. Fewer Hispanic children report excellent or very good oral health than white children. Poor oral health can lead to missed school, emergency room visits, and decreased productivity and quality of life. Women live 4.8 years longer than men, but have more chronic conditions with ongoing medical treatments. They have more heart disease and strokes than men. They experience more functional limitations than men. Women experience higher medical charges for primary, specialty, emergency, and diagnostic services than men. These services tend to be more intensive, and women often delay seeking medical treatment. 12% of women versus 7% of men suffer from major depression during a lifetime. Eating disorders account for high mortality rates. 3% suffer from anorexia nervosa and bulimia. 29 to 38% of women consider themselves on a diet at any given time. 90% of these women are young women. Death related to alcohol abuse has been shifting from men to women. Women are also at a greater risk of Alzheimer's disease. This disease leads to an increase in nursing home placements. Women who work part-time have lower wages and have interruptions in work history tend to be underinsured or not insured at all. More women are on Medicaid compared to men. Access to health care when living in rural areas can be challenging because of poverty, having to travel long distances for care, weather conditions, lack of transportation, and uninsurance. Contributing to the lack of health care is also maldistribution, with fewer health care providers and professionals in these areas. There are 33 million Americans living in rural areas, and they too seek medical treatments. Migrant workers are farm workers who are likely to be uninsured. These workers often travel long distances from home to work. They tend to move with the seasons and move depending on work availability. There are roughly 3 million migrant workers. These workers are considered ethnic minorities, with 72% of these workers being born in Mexico or Central America. Income is well below average. A family income can range from $17,500 to $19,999. Only 57% of these families receive public assistance. 85% are uninsured. 20% of them seek health services. When looking at females who seek prenatal care during their first trimester, only 42% compared to 72% of the national average seek this treatment. Occupational health risks lead to poor health outcomes. These include exposure to chemicals and injuries from farm equipment. Obesity tends to rise after being in the U.S. longer than a year because of diet changes. 81% males and 76% of the females are considered obese. This population has a greater risk of tuberculosis, HIV and AIDS, and other infectious diseases due to the lack of health care. There are approximately 3.5 million homeless people living in the U.S. 63% are men, 37% are women, 22.8% are children, and 14% are veterans. Gender-related issues that can cause homelessness for women are pregnancy, child care responsibilities, and the inability to work during the care of the children, job discrimination, wage discrepancies, and family violence. Many live in poverty. Lack of financial and educational resources lead to homelessness. The majority of the population did not complete high school. They lack access to public services because they cannot provide a physical address. There's a shortage of low-income housing. Many of these individuals lose their homes due to family life crises, rent increases, inflation, illnesses, and reduction of public benefits. Risky behaviors result in poor health, like alcoholism, illegal drugs, smoking, sleeping upright, which can cause venous stasis, ill-fitting shoes as they walk around a lot, inadequate nutrition. There's also an increased risk of assault and victimization. Other risky behaviors include exposure to the elements of severe heat or cold. Due to not having proper ambulatory medical services available, they tend to use emergency rooms and inpatient services for health care. Other issues are lack of transportation, need for food and shelter over health care, mental illness, lack of storage for medications, and lack of cleanliness. Psychiatric illnesses are the leading cause of disability in the U.S. Increased risk factors for death from suicide, cardiovascular disease, and cancer. Suicide is the 11th leading cause of death in the U.S., 4th leading for ages 18 to 65. Mental illnesses can be psychological or biological. The biological are developmental disabilities, mental retardation, and schizophrenia. Among psychological are phobias, substance abuse, and depression. Approximately 4 million children suffer from serious mental illnesses. Only half receive treatment. This can lead to severe mental illness if left untreated. The barriers to receiving treatments is the cost of the treatments and the shortage of mental health professionals. More than 50% of deaths in the U.S. are attributed to heart disease, cancer, and stroke. Heart disease is number one. There are approximately 80 million Americans with more than one chronic illness. Chronic illnesses can be life-limiting, meaning limiting daily living activities, such as caring for themselves. Loss of productivity related to number of sick days or unhealthy days costs more than $15 billion per year. Obesity costs $32 billion, and approximately $153 billion is spent each year on obesity and other chronic illnesses. These chronic illnesses can be very expensive and put an economic strain on the nation. More than $107 billion in medical expenditures a year. Diabetes costs $116 billion. Heart disease costs $474 billion. Behavior risks that are modifiable are physical activity, nutrition, smoking, and alcohol. Only 21% of the population meet exercise guidelines. Less than 25% eat the recommended servings of fruit and vegetables each day, and they consume more saturated fats. Disabilities include mental, which is cognitive and emotional, physical, which is mobility and activities for daily living, or social, being able to manage social roles. 56.7 million have disability. Greater than 38% are severely disabled. Disabilities increases with age, and with this, most have public insurance such as Medicare or Medicaid. Chronic conditions can include arthritis, heart disease, back problems, asthma, and diabetes. What is there for future reform for health services? The Indian Health Service is a federal program for comprehensive and culturally acceptable health services. This is available to members and descendants of over 560 American Indian and Alaska Native tribes. primary and preventative services, along with education for injury control, alcoholism, mental health, diabetes, elder care, maternal and child health are included. Children's Health Insurance Program is for uninsured children. It helps to reduce uninsurance. It improves access, continuity of care, and quality of care for all children. Public Health Services Office of Women's Health has broad spectrum goals for women's health. They are a part of the National Action Plan on Breast Cancer to improve diagnosis, treatment, and prevention through research, service delivery, and education. They promote breastfeeding, education, and research. And they focus on girl and adolescent health and heart health. The National Health Service Corps is a scholarship program and loan repayment program for doctors, midwives, dentists, nurse practitioners, and mental health professionals who serve in underserved areas. This would include focusing on trying to bring more medical professionals to the rural areas. The medically underserved areas designation includes percentage of population below poverty income, percentage of the population over 65 years, infant mortality rates, and primary care physicians per 1,000 population. Rural Health Clinics Act allows for reimbursement by Medicare and Medicaid for services provided by physician assistants, nurse practitioners, and certified nurse midwives.